Good afternoon to you all. Please excuse me, yeah, if I have forgotten anybody here, but I just wish to say good morning and welcome to this press conference as we are here to celebrate the World Pharmacist Day um, here in the Gambia. It is being celebrated everywhere in all the other countries, so we also thought we'll do our part. Um, as the president of the Pharmaceutical Society of the Gambia, and on behalf of all pharmacists in the country, I wish to thank you all for joining us in celebrating this day. For those who have not been part of it, I just want to tell you that we have just come back from a march past, so excuse us. Most of us are looking very sweaty and, a little bit unkempt, but that's because we've just marched from the Westfield Junction to Jimpex Junction here to the KMC Library. Of course, with the police van, and it was very enjoyable and very successful. So I'd like to thank everybody that participated in this march past. Today, as I said, today we gather here to celebrate the World Pharmacist Day under the powerful theme, um, think health, think pharmacist. When we say health, health is quite broad and all encompassing. So I thought this March past is very befitting because it's showing also that we're also being health conscious. We're walking, trying to, you know, encourage the national population to be doing their bit in terms of physical fitness and exercise. So I think that is also one of our contributions to show the population that it is healthy to walk. Also, when we say think health, think pharmacist, I think we all agree that pharmacists are key in the multidisciplinary healthcare team, and we work closely with all the healthcare professionals. So this is actually a joint effort and um, a joint um, practice. Now, pharmacists are usually the first point of contact in our communities, whether it's a drugstore, whether it's a pharmacy, usually before, sometimes, especially if it's not very serious, before they think of going to a clinic or the medical doctor, they'd rather go to a pharmacy or a drugstore, to complain of their common ailments. And not only that, to try and seek the best advice and counseling before they can, proceed with their specialized healthcare. Now, pharmacies are supposed to be giving, and that is what our profession actually encourages, is that being the supposed to be the medication experts. We are the medication experts. We are the custodians of medicines. So being the first point of contact, it is very, very valuable to give this trusted advice to the population, and it is vital for our communities. Pharmacists globally and in the Gambia, as I said, serve as medicines experts in hospitals, health centers, community pharmacies, clinics, and public health programs. Part of the medication experts is, as I said, we work as part of the team. We work to do clinical assessments when we're doing ward rounds in hospitals to try and give advice, and counseling, to patients, and giving advice to doctors to prevent, for example, medication drug interactions, and also to prevent, at least to reduce the amount of safety drug safety yeah, advice and patient safety advice. Part of our role also is, what they say called economic impact, where we do some risk mitigation strategies. We also do quality assessment, of the drugs. Is this drug better than this? Is this drug more cost effective than that? And also part of the prescription is also developing formulary management um, documents. Key also to all this is that we make sure that we give good advice and review prescriptions very well. Prescriptions, doctors in this part of the world, we all know doctors, all sorts of expertise, specialized, you know, other specialized health experts, when they do their prescriptions, pharmacists are supposed to review these to check whether there are interactions, get back to them, communicate effectively to make sure that it is the patient's safety that comes first. So all healthcare workers should work as a team to make sure that the patient's um, health and safety come first, which includes, as I said, assessing that the medicines we're using are of good quality, they're safe, and they are actually efficacious. Pharmacists also serve as health educators. We, at as the Pharmaceutical Society, I think Mr. Diallo rightly said, are actually trying to um, train, um, dispensing assistants and people that are working in pharmacy or drug outlets to know more about medicines, so that they'll be more effective in dealing with patients and delivering safe and efficacious medicines. Immunizations. We also, as pharmacists, participate in healthcare programs, and we usually support in the supply chain management and logistics for immunization programs, especially in the public health sector. We are also forefront in combating antimicrobial stewardship. We all know that we can't go far without the use of antibiotics. But we also know that antibiotics are highly abused, especially in this part of the world. So there are lots of studies and lots of strategies that we are doing to try and make sure that antibiotics are not being overused, and also we use antibiotics that are effective against infections and not be using outdated medications. We also provide a lot of help and a lot of assistance in also mental health and counseling um, um, and monitoring. We have gone through a few research to show some of the impact that we have as pharmacists, and some of them are actually studies. We had some studies that were done that showed some, for example, medication errors. As I said, being the experts in medication errors and working as part of a multidisciplinary healthcare team, a study showed that 78% reduction in medication errors in hospitals when you incorporate pharmacists in the healthcare team. Also, another study, an impact study, showed that 25 to 40% decrease in a 30-day hospital admission because of the incorporation and the support of the pharmacists in the healthcare team. We managed to reduce 25 to 40% of hospital readmission. It was shown that some of these hospital admissions are mostly due to either drug-drug interaction or medicines not being used properly by patients. So if you have effective use of our pharmacists and our pharmacy support personnel, it means that we can reduce some of these issues. Um, Also, we did also mortality reduction studies that were done, which showed a 16% decrease in hospital mortality rates. Again, because of drug safety, drug effectiveness, and drug-drug interaction. These are some of the few things that I thought I will highlight to show some of our roles. That pharmacists are not there just to dispense drugs. Pharmacists are there to counsel, to educate, to advise, to show that medicines are being safe, and that the patients are actually being treated very well. Pharmacists are also supposed to serve as bridges between patients and other healthcare providers, identifying other health issues that might otherwise go unnoticed and referring patients for appropriate care. Our role in the COVID-19 pandemic, I think, was very much highlighted where as the pharmacy profession, we, participated in a lot of research, in a lot of um, drug, production also that helped with the elevation of this disease. So as not going too much, because I have my colleagues to talk about some other parts, but I'm just saying that as we celebrate this day, we recognize the ongoing need to strengthen the pharmaceutical education, expand the access to essential medicines, and also support our pharmacists with the resources they need to serve effectively. The Pharmaceutical Society of the Gambia therefore remains committed to advancing our profession and to improving the healthcare outcomes for the population here in the Gambia. So to all our pharmacists, it's our day today. We support all healthcare professions, but today is the day of the pharmacist. So I'm saying to all our pharmacists that your dedication, your expertise, and your compassion makes a difference every single day. To the public, we want you to remember that your pharmacist is a healthcare professional that is ready to support your health journey. Think pharmacist, think health. Thank you all for your kind attention.